Good afternoon. My name is Betsy Zemmel. I'm an audiologist over at Cadlick Audiology Clinic. Welcome to February's Healthy Ages presentation. Today I'm going to be talking about hearing loss and intervention. And where's my clicker? Oh, right here. So, I'm going to be introducing you, what is an audiologist and what is audiology. I'll be talking a little bit about anatomy and physiology of the ear and talking about some research, some of the latest research in audiology, which will hopefully give you some insight into just how we hear. And then at the end, I'll give you a little overview of our clinic here at Cadlick. So what is an audiologist? Well, what is audiology? So audiology is the science of hearing and balance-related disorders. I love my job. There's so much variability throughout the day. We see all ages across the spectrum. We see newborn babies just a couple weeks old all the way to triple digits. So I'm always learning every day, every appointment, it's something new. So it always sort of keeps me on my feet and is exciting to me. Audiologists must earn a doctorate of audiology degree. So this does require 4 years of undergraduate study as well as 4 years of specialty studies. And that includes a 1-year residency. So this is my team. There are 3 audiologists that work at Cadlick. Does anybody recognize any of these people? I see some familiar faces out there. Dr. Curtis Wolf, he's amazing. He's been here for 5 years, so he's kind of our salty old veteran who knows everything. And then Dr. Christina DeRocher and myself arrived here about 2 years ago. So I completed my doctorate at Indiana University in Bloomington, Indiana. Are you from IU? Awesome. You too? No, okay. So Cadlick recruited me. I came out here, interviewed, and I loved the feeling of the community here and the small hospital. And so my husband and I packed up with our dog, Merle Haggard. And we drove across the country and had a blast coming out here. We took about a month road trip to get out here, so that was really fun. So we're kind of settling in and really getting to know the community, and I love this opportunity to just meet, the people in my community. So what is hearing loss? Starting with what is hearing? So hearing is the transduction of sound from outside of our ears that travels into nerve impulses and is sent up to the brain where it's interpreted. So hearing is the perception of sound, but listening is the ability to make sense of that sound. And we'll keep returning to that throughout today's talk. So hearing is the perception of sound, and listening is the ability to make sense of what that means. Can you guys still hear me okay in the back? Okay. So what is hearing loss? Hearing loss is an impairment along any part of the auditory pathway, which we'll delve deeper into. And it can also, patterns of hearing loss can also indicate sometimes medical conditions, not just, hearing loss. So a little bit of anatomy and physiology. We'll start with the outer ear. So this part of the ear right here is called the pinna, this outer part. Its job is basically to act as a funnel, collecting sound and sending it inward to the eardrum. The middle ear space consists of these 3 tiny, tiny little bones called the ossicles. And their job, they're so tiny that all 3 of them can fit onto the size of a dime, that small. But although they are tiny, they are mighty little bones. They have a big job. Their job is to amplify sound about 30 decibels, which is half the volume of my voice, in order to prepare that sound to enter the inner ear, which is filled with fluid. So you have these little bones working in a lever-type motion to amplify sound, because sound travels differently in air versus fluid. So it's really got to amp up that sound. So then the sound hits the fluid-filled inner ear. So we have the cochlea right here, which is the hearing organ, connected to your balance organ. We won't really get into that part today, maybe next time. So the cochlea is the hearing organ responsible for the initial processing of sound. And housed in the cochlea are these tiny little hair cells that sense vibration and movement, and then transmit that sound into neural impulses, which then get sent up to the brain. So the cochlea is kind of like a snail shape, and if you were to unroll it, it's almost like a piano. Each part of the cochlea is tuned to a very specific frequency or pitch. Any questions so far? Yeah?
The cochlear implant, is that where it goes?
Say that one more time.
The cochlear implant for deaf people, is that where?
So she's asking, the cochlear implant, which some people have, is inserting basically these tiny little electrodes into the cochlea if the cochlea is not working anymore, so that sound can be then transmitted to the nerve. So some individuals who do not have a functioning cochlea anymore may be a candidate for a cochlear implant. So at Cadlick Audiology, we pretty much practice the whole scope of audiology except cochlear implantation. So we'll usually refer out to Spokane or Seattle for that. So we have sound that is transferred from air to fluid and now being transmitted through electrical impulses up to the brain. So let's kind of put that all together, looking at the peripheral portion of the ear. So you have the ear canal, or I'm sorry, the pinna, this part of the ear, which again is funneling sound in through the ear canal. That sound vibrates against the eardrum, causing those three little bones to move in a lever-like motion, amplifying sound so that the sound maintains its volume once it hits this fluid-filled cochlea. And those hair cells help to transmit that electric signal to the nerve, which is then sent up to the brain. So let's talk a little bit about types of hearing loss now that you're a little familiar with the anatomy of the ear. So we have three major types of hearing loss: conductive hearing loss, sensory neural hearing loss, which can be a combination of sensory or neural, and then a mixed hearing loss. So conductive hearing loss is any part of the outer ear, ear canal, eardrum, that air-filled space in the middle ear with the three little bones. So types of conductive hearing loss could be impacted cerumen, so much wax in your ears that it's actually blocking sound from being able to get into your ear. Some people are born without the pinna or without an ear canal. You may have a perforation or a hole in your eardrum that's causing hearing loss. This space beyond the eardrum may be filled with fluid, it may be infected. Children oftentimes have middle ear infections, that's where the loss is coming from. And then sensory neural hearing loss. Sensory loss is coming from the cochlea or the nerve. And a mixed hearing loss can be a combination of any loss coming from any part of the ear. So you may have a permanent sensory neural hearing loss and then your ear fills up with wax, so now that wax is compounding your hearing loss, making it even worse. So in audiology, we describe hearing loss in terms of severity. So we don't use percentage to describe how much somebody has hearing loss. So you might be a little familiar with this graph. Up here you have pitch. Here you have volume. So all these different pitches make up the parts of speech. So you have the low pitch regions are where the vowels come from. That provides base and volume of speech. And as you move higher in pitch, you have the consonants that provide clarity of speech. The volume scale, very soft to very loud. Hearing loss, again, is described in terms of severity. So normal hearing, slight loss, mild, moderate, moderately severe, severe, and profound. So we want to know the type of hearing loss, so where in the ear is it coming from? We want to know the configuration of hearing loss, so what kind of shape and pattern is the hearing loss, because that will really dictate how we treat the hearing loss. And then we want to know the severity of loss, so how bad is the loss? So this is a common pattern of hearing loss that we see with age-related hearing loss. So age-related hearing loss, the fancy name for it is called Presbycusis. But you know, it's nearly impossible to know for sure what exactly is contributing to presbycusis, because we know that not everybody who ages develops hearing loss. And there are so many things that can contribute to hearing loss, such as metabolic systems, genetic predisposition, history of noise exposure, and just the environment around us. So this kind of hearing loss, presbycusis, is commonly described as, I can hear people talking, but I can't understand what they're saying. So they've got good hearing in regions of volume, so they know that people are talking. It's not that they're deaf. But because those consonants are completely inaudible to them, they're not getting distinction or clarity of speech. So my husband came up with this joke because it's kind of funny. Somebody says, "Hand me the pen," and somebody says, "Did you say give me some jam?" Because they're not distinguishing what's being said. That's a bad joke. Ah. So what we're learning in research, in audiology research, is that the audiogram, the hearing test, is really just a snapshot into how we hear. So the audiogram, where you're in the booth and you're clicking the button when you hear the beep, that gives us a very small picture of how people hear. It's a measure of sensitivity, so how soft can somebody hear all the parts that make up speech. But it doesn't require any sort of higher level processing. I often tell my patients, you know, you may have the exact same pattern of hearing loss as your best friend, but you guys process that and have a completely different experience. So not everybody with this type of hearing loss necessarily experiences it the same way. So if the peripheral part of the ear is really just the gateway into how we hear, so what is the brain's impact on hearing? So I'm going to be looking at some research that I'm really interested in, because it helps me to provide counseling to my patients so that they really understand what hearing is. And this is a really hot topic in audiology now. I got to see Dr. Anu Sharma from University of Boulder, Colorado, speak in Indianapolis last year. So I'll be explaining some of her research today, as well as Dr. Frank Lin from Johns Hopkins. His research is kind of also hot in our profession. So is everybody still awake and excited? Okay. So neuroplasticity and hearing. So what exactly is neuroplasticity? It is basically the brain's ability to change and adapt, and in its broadest term. So neurons and networks within the brain can alter their function. So what Dr. Anu Sharma is really interested in is how hearing loss affects the brain. So she looks at what's called cross-modal reorganization. And all that really means is that the brain can, like I said, alter its function when necessary. So looking at the brain, all you really need to know for the presentation today is that the temporal lobe is where hearing is processed. The occipital lobe is where vision is processed. And reorganization of the brain occurs with any sort of sensory deprivation. So an example of sensory deprivation would be a blind individual who cannot see. They're getting no visual input, yet their hearing system is intact. So the vision part of their brain, it doesn't just die off. It becomes repurposed based on whatever system that they have that's intact. So if they have really good hearing, their hearing centers begin to take over the vision center. So I find that very fascinating, that vision part of the brain, it doesn't just die off, it becomes repurposed. So what exactly does that mean in terms of hearing? So this part can get a little murky, so just kind of stay with me. And if it gets too confusing, somebody can just raise their hand and I'll slow it down and try to explain it better. So let's start with auditory deprivation. Auditory deprivation is hearing loss. We've known for a long time in research that in extreme situations such as deafness, there are brain changes. So there is restructuring going on within the brain when there's deafness. So there's no auditory stimulation getting to the brain. But what Dr. Sharma's research has shown us, which I think is really fascinating, is that even with a mild loss, even with a mild sudden loss, this remapping, this reorganization within the brain is already starting to begin. So she had one of her subjects lost their hearing overnight, and she threw her subject into her laboratory the next day, and they were already seeing these changes occurring within the brain. So at that point, the visual system was already starting to be activated with some hearing loss. So when you have an intact system such as vision, that can help to sort of compensate for loss that you begin to develop. So at her point in her research, she's finding that the place in the brain that's supposed to process hearing is now becoming repurposed with hearing loss. So now the auditory center part of the brain is becoming activated with a visual input. And what they also started to see was that the frontal part of the brain was also lighting up, meaning that effortful listening was putting some strain on cognitive function. So effortful listening is trying to understand what people are saying, so reading lips, trying to put things together, trying to build what people are saying based on the context. So you're really straining to hear. It's not just coming easily. And that is very taxing on the cognitive part of our brains. So in some, even with a mild hearing loss starting immediately, she's seen that there are changes going on within the brain and that the brain is working harder to hear. Is everybody with me still? Okay, cool. So let's talk a little bit about cognition, cognitive resource allocation. So what does this mean? I'll kind of break it down for you. Think of the brain as having a finite amount of resources, like money in the bank. I have a finite amount of money in the bank. Now think of effortful listening that we were just talking about, straining to understand what people are hearing, really, trying to put things together. When you are allocating so much of your brain resources to try to understand what people are saying, then that doesn't leave a lot of brain room left over for other things such as working memory, which is really important. So what exactly does this mean for the patient? What her work is suggesting is that if we can intervene early, as soon as hearing loss starts to develop, then the treatment, the rehabilitation process with hearing aid devices may not be such of a struggle for patients. So typically when we think of early intervention, we think of children. We think of intervening with the pediatric population to ensure identification of hearing loss and treatment of hearing loss so that they don't have any developmental delays. But what her research is suggesting is that we need to extend this term early intervention to all ages, not just young children, so that we can provide the opportunity to have a more successful experience with hearing aids. So what's interesting to me is that hearing loss is one of the most common chronic health problem among older adults, and it takes people 7 to 10 years to finally come to terms with the fact that they need hearing aid treatment or hearing treatment. So, and there are a lot of factors that go into that thought process, including financial restrictions. They're definitely a big investment. Stigmas, there's age-related stigmas associated with hearing loss, but that's changing a lot. Also, I think patients not being properly counseled on what exactly hearing loss is and how it relates to them and their life, and not really understanding what hearing loss is. So maybe somebody thinks hearing loss is when you have complete loss of hearing, but that's not true. You can still, like we saw with that Presbycusis pattern of hearing loss, you can still hear, but distinguishing what's being said is difficult. So think of that 7 to 10 years, how stubborn those neural networks become in the brain. So you're relying heavily on your visual system to compensate for your hearing loss. So that hearing part of the brain is sort of not really a hearing part of the brain anymore. It's the visual part of the brain has extended and adopted that part of the brain. So that by the time you put hearing aids on somebody and try to treat the hearing loss, that center in the brain is not very happy because it's so confused. It thinks it's the visual center. So the moral of the story is that we want the auditory center to function as the auditory center, not the visual center. Does this make sense so far? It does. Okay. So this will become kind of confusing and it can cause problems with listening. So as I said, the longer the hearing loss goes untreated, the more difficult, the more frustrating it can become when you finally decide to treat the hearing loss.
So if we poke our eyes out, we'll hear better?
If you poke your eyes out, you'll hear better. So, can hearing loss cause dementia? So there's a lot of misinformation kind of floating around out there. one of my patients told me one time that when you turn 65, you just get flooded with all sorts of spam about hearing aids and, this, and what?
Burial.
Yeah.
Neptune.
Oh, cremation. Okay. That is sad. So cremation and hearing aids. But I think that there's a lot of misinformation, and some of this research is used more as a fear tactic. Hearing loss does not cause dementia, and I say that because there's no direct link. It's not causing dementia. But what research heavily tells us is that there's definitely a connection, but they're still trying to figure out why. Is it because when you develop hearing loss and you're struggling to hear people that you slowly withdraw because it's hard to go to social situations and you'd rather not go through that work. So you kind of start to withdraw, stay at home, and there's kind of a ripple effect of lack of sensory input into the brain. So research does tell us that there is a connection between hearing loss and cognitive decline, but hearing loss we cannot say is causing dementia. But their findings are also suggesting that it doesn't hurt to try hearing aids and treat the hearing loss so that you're not experiencing that cognitive strain, which does, tax that part of the brain, which should be used for things like memory. So we're hopeful that hearing aid devices can help with cognitive performance. So just kind of reviewing in summary, this reorganization occurring in the brain, this remapping, this restructuring, it can lead to more effortful listening and cognitive strain. And there is a strong correlation between hearing loss and dementia, but we don't know that it's causing it. So the speculation is that this reorganization, is impacting cognition, potentially contributing to some of that decline. And we're hoping that hearing aids can help to reverse any kind of those networks that start to develop when you're relying on other systems such as vision. So this is my take-home message, is that the sooner the better to get that process started so that it's not so frustrating and it's not such a struggle. So how do you know when you need to have your hearing tested? So some symptoms of hearing loss may be ringing in the ears, which is called tinnitus, ringing, buzzing, chirping, hissing, humming, whatever you call it. All of the above is typically secondary to some kind of hearing loss. So a lot of times we'll have patients come in for tinnitus, and it's actually that they have a high-pitched, a high-frequency hearing loss, and that sound is secondary to the hearing loss. So that's kind of a symptom of hearing loss. Difficulty distinguishing words, especially in a noisy environment like a restaurant, is a symptom of hearing loss. Difficulty understanding what people are saying on the TV. So when you rely heavily on vision, on lip reading, when you have hearing loss, you can get by in a quiet room, in a well-lit room where you can tell people are talking. But on TV, you can't, the mouth is not always projected at the screen, so they're turning constantly, switching scenes, so you can't really follow visually, which is why some people complain that it's difficult to understand the TV. Captions, yes. So baseline hearing evaluations are always a good idea. Just even if you have normal hearing, at least we have documentation of what your hearing is in case anything ever changes. We have something to compare it to. So our clinic is located at Swift and Goethals, 780 Swift Boulevard. You're welcome to come see us. You just need to obtain a referral from your primary care if you believe that you have hearing loss. So what happens is you come in for the hearing evaluation, we do the testing, talk about the results and recommendations. So you have to have a hearing evaluation completed within 6 months in order to be fit with hearing aid devices. So if you're a candidate, you do need to have a hearing evaluation. So at that point, then we set up what's called a hearing aid consult. So the consult is a time, it's informative, and you're not pressured to make any kind of decision at that point. I'm just giving you all the information that you need so that you can go home and talk to your people, talk to your family, and feel confident about how you want to proceed. So we'll talk about price, of course, and your budget and what goes into the costs of devices. We'll talk about style, color, and any questions that you have. If you have a neighbor that hates their hearing aids and they put them in their drawer, we can talk about your neighbor and why they do that. So we offer all brands of technology, and they're all good. There's not one that's more fantastic than the other. They all pour so much money into research and development of these devices. The devices are engineered to mimic the way that we hear with our ears. So our ears are always taking inputs and to decide where people are talking from, who's talking, trying to figure out what is just background noise and what is the signal of interest, which is speech. So our business model at Cadlick is a little different than traditional. So we do what's called an unbundled cost, which traditionally, if you are investing in hearing aids, you kind of pay this big lump sum. We'll just go with $5,000. And you're paying that big lump sum, but you don't know exactly what is going into that cost. So, and sometimes you end up paying for services in that big lump sum that you may not even ever get. So what we do is we just itemize everything. So every service, everything is separated so you see exactly what you're paying for and what goes into that big chunk. And then that way you can kind of control costs a little bit. So I think that's about it. I think all I want to say is that although hearing aids are definitely an investment, it is a relatively small way to really improve your quality of life. Hearing is something that we take for granted until it happens to us, but it's a major player in how we live our lives and connect with people.